I wanted to learn about something that millions of people are dealing with every day. Where else would I go other than Southwestern Eye Center and Dr. Kusman right here to learn really in depth? And we're talking about cataracts. And we were just talking a few moments ago, you were saying most people may develop this. So I think it's very important that we let people know really what it is and what the symptoms are. So I know, Doctor, you're really good at explaining kind of the anatomy of what we're dealing with. Let's kind of start there.
Okay, sure. Let's take a model of the eye and show the anatomy of the eye. The front portion of the eye is the cornea, which is the clear transparent membrane which sits in the front of the eye. Behind that we have the iris. In the center of the iris we have the pupil. Behind the pupil we have the lens of the eye, which is responsible for focusing the light onto the retina, which is normally clear and transparent. Behind the lens we have a cavity that contains a jelly-like substance that we call vitreous. Behind that we have the retina, which is the nervous tissue connecting to the optic nerve to the brain, where the light images are focused in the back of the brain and gives us the vision that we see.
And so where do cataracts come into this anatomy?
Cataracts is in the natural lens of the eye. When this lens becomes cloudy, it impedes the light from entering the eye, being transmitted to the back part of the eye and being focused on the back part of the eye, on the retina.
So now that we know what the cataracts are, kind of tell me the symptoms that somebody might start to experience when they are first developing it.
Okay. Usually there's a blurring of vision, and that can be from near to far, far to near, from light to dark, dark to light. Sometimes when people are reading for a prolonged period of time, words start blurring out on them. They may start developing halos or rainbows around the lights at night. And another common symptom is glare, especially riding against the sunrise or against the sunset, or at night seeing halos and glare around the lights at night and not being able to establish the distances where they are.
Okay, and so is there maybe a specific type of person that may get cataracts?
The most common cataracts that we see are usually in the 50 and beyond age group, which is what we call a senile cataract, and that's just a normal aging process of the natural lens.
Okay, and so once we've noticed that we're having these symptoms, we come in. What kind of treatments or surgeries may be available to us?
Well, the first thing you want to do is to try to see if you can correct the patient's vision with glasses or contact lenses. If that does not suffice, then we resort to surgery. Surgery today is so much different than what it was years ago. Today we use a very, very sophisticated ultrasonic or phacoemulsification method of taking out the cataracts, which is done through a 2mm sutureless incision under topical anesthesia, with the patient being awake or mildly sedated. Through this 2mm incision, we insert an ultrasonic tip which vibrates back and forth at 40,000 cycles per second, and this actually emulsifies the lens and we suck it out, leaving behind just the envelope of the original lens where the cataract was. Then we take the artificial lens, the intraocular lens, and we place it through that incision into that little sac that we've created.
And because I've come out here and spoken with you, and now I'm a little bit more educated as well, I know there's different lenses that come along with this, right?
Sure, I can show you some of them.
And so these are the different lenses that you were saying would go in during that surgery.
That is correct. This is the lens. This is what we call a monofocal lens. A monofocal lens is a simple lens that can either be correct the distance for correct the vision for distance, for intermediate vision, or for near vision. This lens is the most common lens that we use. It is fully covered by the insurance companies. Then we have technologically much more advanced lenses that we use for different conditions, such as those patients who have a significant amount of astigmatism. This lens is what we call a toric lens. A toric lens actually has the astigmatic correction in the lens implant itself. The use of this lens enables much better quality vision than not using this lens and using glasses with the correction in the glasses. Then the third type of lens that we use is even more sophisticated, and we call a multifocal lens. A multifocal lens consists of a central near lens and then the concentric lenses around it to enable the eye to focus the light rays from distance all the way into near. So this is for patients who want to be without glasses, and so we insert this lens into those kind of patients. But there's certain parameters that we have to stick to and make sure that the rest of the eye is totally normal before you go to this type of a lens implant.
Well, this is exactly why the first thing once you start to experience some of those symptoms is to come in, definitely come and see you, doctor, and then somebody here at Southwestern Eye, and you can develop whatever treatment is, preferred for each individual person, which lens, whether it's surgery, whether it's glasses. That's exactly why you're here for us.
That's correct.
I think that's amazing. And as I said off the top, it's millions of people that are dealing with this every day. And some people maybe get to that 50 or 60-year age and think, oh, it's just aging, it's just my eyes. But it's always best to see if maybe this is something that can be fixed.
Absolutely. Don't forget that there are other causes of cataracts other than the cause, which is, the aging type of cataract. They're congenital cataracts. Their cataracts are going to occur with certain metabolic diseases such as diabetes, galactosemia, myotonic dystrophy. We can get cataracts related to blunt trauma or penetrating trauma. Certain drug use such as steroids can produce cataracts. Patients exposed to excessive radiation or heat can get cataracts. And you can also get cataracts related to inflammation in the eye, secondary to things like glaucoma, previous retinal surgery, tumors in the eye. And there are other causes of cataracts as well related to other much more different diseases.
Well, I always get so much more education whenever I come to see you out here, doctor. So thank you again so much for educating everyone at home and myself as well. So thank you again.
Thank you very much.
Now, for more information about Southwestern Eye Center, call 798-8888. Again, that's 790-8888.